Hello, my name is Rachel Sachs, and I am an oncology social worker and the Senior Director of Education and Programs at Cancer Support Community. I have worked in the healthcare field for over 25 years, and I have seen significant changes through our healthcare system. I have been asked to address a recent poll conducted by No AML, which showed that our community was partially satisfied with the availability of information on newer treatments. The questions are, what can we do to make the information more available? And why is this information important to inform shared treatment decision-making? So let's address this. Why is this information important to inform shared treatment decision-making? So first, we need to level set on what is meant by shared decision-making. This concept is being embraced significantly by the medical community, advocacy organizations, patients, and caregivers alike. So we need to understand what is meant when we refer to this. The National Cancer Institute defines shared decision-making as a process in which both the patient and healthcare professional work together to decide the best plan of care for the patient. When making a shared decision, the patient's values, goals, and concerns are considered. Shared decision-making helps patients learn more about their health condition, the different testing and treatment options that are available to them, and the possible risks and benefits of each option. With shared decision-making, the importance of knowing how to communicate with your team and having the information to have sound and thorough discussions with them is absolutely critical. It's also important for patients and caregivers to share any and all questions that they may have, any concerns, and even their preferences or personal goals that they may have around treatment. In today's society, we are a world of information seekers. There are so many available sources of information. Of note, it's essential to stress that we all need to be careful when looking up information, and that we should always seek the most reliable information from the treating healthcare team. We are a society and culture that is truly advocating for ourselves and our loved ones when it comes to seeking medical opinions, selecting a healthcare team, and making treatment decisions. Because of this access to information and the importance of shared decision-making, patients and caregivers are coming armed with information to their medical appointments. Our community is thirsty for the most current and updated information when it comes to being diagnosed with any medical diagnosis, especially one such as AML. And not only are our patients and caregivers coming armed with information, but they need the most current information and deserve this information to make the best and most comprehensive treatment decisions to be active members of the shared decision-making process. So we've addressed what shared decision-making is and why the most current information is essential for the shared decision-making process. Now, how can we make information more available and accessible to you, our community members? It's the role of all members of the healthcare community who actively treat and care for AML patients to be proponents of making the most up-to-date information available. This includes advocacy organizations who focus on providing education, programming, and moving forward policies for the AML community. Organizations whose mission it is to empower cancer patients and their care partners have an absolute responsibility to address these educational challenges. We can do this by forming collaboratives, roundtables, and coalitions made up of advocacy groups who are stakeholders in this field. This also includes bringing local community members who treat AML patients from all communities, as well as leading experts in the field, including those who are treating patients and doing research in this area together. By bringing together various members of the AML community and working together along with our patients and caregivers, we can discuss the barriers that exist and continue moving the needle in the right direction. I would also stress it's essential for both patients and caregivers alike to speak up and share your voices. When disparities exist, it is absolutely critical to hear from those who are living the experience. The AML community can make a difference, especially our AML survivors, by getting involved in organizations where you can be heard and help contribute to education initiatives, the development of new educational resources and programs, and getting involved in policy initiatives. You, our AL community, is strong, and we need to work together to give our patients and caregivers the tools and resources that they need and you need so that we can work with their healthcare teams to make the best treatment decisions for everyone that incorporate the latest and most updated information. Thank you.